For my presentation, I wanted to focus on what is an ideal model of a doctor-patient relationship in medical decision making. This is a very significant issue because as a patient, you want the best relationship with your doctor because at the end of the day, you are trusting the doctor with your life. And in the physician's perspective, you want to practice good morality with your patients. It is important to respect a patient's autonomy. Autonomy is the right to self-govern without the influence of others. For example, a doctor having an influence over a patient's decision. The ideal relationship between a care provider and a patient is to be completely honest with the patient and thoroughly explain the patient's diagnostic and line of treatment. Patients have the right to refuse at any time any treatments that are recommended by their physician if they do not agree upon them. We have a few common reasons why patients may refuse a care provider's recommendation. For example, religion. In religion, you believe that God will take control and you don't need any medical intervention because God will heal you. For example, Jehovah's Witnesses not accepting blood transfusions. Another instance would be finances. Sometimes patients don't have medical insurance, and it is known that medical interventions may be pricey. Therefore, they might refuse it for that instance. The paternalistic perception. Paternalism, interfering with the person's decisions for their well-being. The thought of paternalism can be seen between a child and their parent. In this case, paternalism can be presented from the care provider to their patient. This can occur when the care provider reveals one-line treatment rather than other options to achieve the patient's best interest. In other cases, care providers can justify their paternalism when a patient is mentally ill and cannot fulfill to be a good candidate to practice autonomy. Assumptions regarding paternalism. A known assumption regarding paternalism would be care providers will persuade patients with the option they recommend to obtain more money from the patient's insurance. Let me give you an example. A patient may be eligible to try several non-invasive treatments to treat irregular bleeding, but her gynecologist recommends the patient to do a hysterectomy. The average hysterectomy costs $4,300 to $11,000 depending upon where the surgery is performed. Can be a surgical center, can be a hospital, whereas birth control can be a non-invasive option and would be significantly less. This puts the patient in risk because you're exposing the patient to risks that they're not supposed to even be in. Risk of infection, risk of losing their life because it's still a surgery that requires anesthesia. So is this really caring for the patient or is this caring to make more money? For a good relationship between a doctor and a patient, there must be virtual ethics. Virtual ethics is an approach in which you apply virtuous habits in order to live a moral life. As a care provider, you must display virtual characteristics. This will indicate that you will be full of integrity, be fair, and be unbiased towards any individual, no matter the race, no matter the gender. Basically, in this aspect, you're being compassionate towards the person, not seeing the person as an item, but as a personhood. Being fair, making sure that all patients are treated equally. This will allow a more connective relationship with the patient, and the patient will recognize that. Fundamentals that are required in mutual decision making. Establishing good communication is an example, meaning the doctor will make sure that the patient fully understands everything in that visit, and the patient will express any concerns if they do not. No matter how time-consuming it may be, the patient is not leaving the room without knowing anything. Informed consent. This means the doctor is educating patients on a specific procedure, allowing the patient to know the possible risks and benefits, and overall giving them the alternative option they can decide upon. This means that the patient is in control of the final decision. Trust. Trust is an essential when it comes to a patient and the care provider, because this will allow the patient to follow the care provider's recommendation. Meaning, the doctor will recommend a certain procedure or a certain non-invasive procedure, and because the patient trusts the doctor, the patient will lean towards that option. Here are more suggestions to strengthen the relationship between the patient and the care provider. Avoid overbooking patients. This is very important. This will eliminate excessive waiting time and more time to connect with the patients in the room. Getting to know a patient. This will allow the patient to trust their care provider and will respect any opinion that comes from them. Language barrier. If possible, incorporate bilingual staff. This will allow patients to fully understand without having a language barrier. Costs. Understand that people may have financial barriers as well. Therefore, being accommodating as possible when it comes to pricing medicine is very important. Incorporating financial plans would be helpful to minorities as well, because it's better to pay within a plan rather than pay completely. Here are some benefits that come from a shared decision between a patient and their care provider. Knowledge. Both parties have the knowledge to make the decision, which will best benefit the patient. All questions and concerns are addressed. In this aspect, the patient will have more knowledge to make the correct decision. Loyalty. Patient is satisfied with the care provider and will continue to see him or her. This will allow for the patient to recommend the doctor to their family members, to their friends, to their acquaintance, because patient fully trusts her care provider and is satisfied to the point that she will recommend it to others. And that will not only benefit the patient, but it will benefit the care provider.